Welcome to Public Affairs Roundtable, a discussion of current events in the nation and around the world and how they affect the people of Indiana. Here's your moderator, Larry Lough.
The Delaware County Health Department has come under some scrutiny lately as to its effectiveness as to possible criminal activity. Today on Public Affairs Roundtable, we'll look at the county health departments throughout Indiana, how the system works, what it is a health department does, and where it falls in the governmental cracks between local, state, and federal agency. Our panelists today are Dave McCarty, Director of External Affairs with the Indiana State Board of Health, Lorraine Jones, Assistant Professor of Community Health Nursing at Ball State University, and John Rouse, Executive Producer of Public Affairs Roundtable and a member of the Political Science faculty. Dave, if you can explain to us, maybe it can't be done in 25 words or less, but what is the jurisdiction of a health department, and what is it? Is it a local agency? Is it a state agency? How does it get involved in federal regulation?
Well, Indiana believes very strongly in all forms of government agencies, basically, that authority ought to be decentralized, that they try very strongly, the legislature feels very strongly about keeping authority for local programs in the hands of local authorities. They don't like to intervene and to impose unnecessary standards, and that would be an impractical way to do it anyway, because of the tremendous disparity between Indiana counties. When you have everything from Marion County and Allen County with large population centers, large cities, tremendous problems in all areas of public health, down to places like Switzerland and Ohio County, which are so small they don't even have a full-time public health department. So basically, it is left up to the county level to decide for themselves what sort of an infrastructure they want to develop for themselves.
And when you talk about public health, you're talking about a wide range of areas.
Oh, yeah, it's very wide. At the State Board of Health, we have a separate division called the Division of Local Health Support Services that deals specifically with the relations of state government to the local health departments. There are 96 of them in the state. See, it's so convoluted that there isn't even one per county. In Lake County, for example, there are several local health departments, but there is no one all-encompassing one that covers the entire county. So it's a tremendous maze of different approaches to trying to solve the same problems. What we do is we have developed a set of local health standards that include 11 different categories of services that the people of Indiana need to have provided to them. It includes everything from animal and mosquito control, communicable disease control, vital records, food inspections, administration, a whole host of other areas that basically we have a set of standards that we have drawn up that each county can use as their roadmap, if you want to use that kind of a term, to achieve the best possible blend of those services that serve the needs of the people of their county. And again, because each county is so different from their neighboring counties and from other counties in other parts of the state, there's nothing that dictates that you have to provide X amount of this service, Y amount of the next service, and Z amount of another service. Each county is free to make their own decisions how much of what kind of service they want to provide.
It's a State Board of Health job, but to monitor this performance, though. So when you're
Exactly.
talking about 11 categories in 92 different counties, you're obviously not able to evaluate them by the month or even probably by the year.
We do a pretty regular review of each local health department. We have 12 full-time staff professionals in our support services division. And what they do is they work with each local health department to write a plan. They go in and they will look at the day-to-day operation of the health department and the long-term goals, whether they're thinking about the future. A lot of the smaller departments don't even have the kind of sophisticated planning that would let them plan budget needs for the next 2 years or 3 years or 4 years out. They have trouble anticipating some of the problems that are likely to develop as their population grows or as new industry moves in. And our role is to come in and help them look at their future needs and plan for those, and also to assess what they're doing right at the moment and deal with that and develop a plan that will help them best take whatever resources the county has decided that they want to allocate to public health and then use that in the most efficient way possible to provide the best mix of services for the people of their county.
If I could ask Lorraine a question. Lorraine, you have been a member of a local task force. As Dave is saying, the citizen is very much involved in this. how is the citizen involved through task forces and also being a member of a local county health board?
The citizens very much are involved. What is a real concern is that these kinds of things go on. The accountability, that's the real factor. Public health is the name of the game as far as saving monies to the taxpayer. And so we're very much concerned as to what's going on at the local Board of Health. And in fact, who are they accountable to? There's a real line here of accountability.
So in a sense, you have, as Dave said, you have a very decentralized system. You know, the thing that we look at in terms of political science, we look at three kinds of politics. So one kind of politics is a partisan politics where you have personalities involved and also partisan political parties. In terms of our local situation, our local county, of course this varies from county to county, but there are 4 persons appointed by the city of Muncie. There are 3 people appointed by the council, the county council.
The commissioners.
The commissioners. So the commissioners appoint 3, the mayor appoints 4, and no political party can have any more than, I believe, 4 persons out of the 7. So you have a partisan input in terms of people who are members of political parties who, and of course Indiana is a very partisan state, so you have this kind of input. And then those people who are appointed to the various county boards of health, they then make the policy. So you have policy decision making, which is a second kind of politics. So you have to ask, what are the policies being established by the people who are members of the various boards? And finally, you have system politics. And in system politics, you ask the question, what kinds of criteria, what kinds of credentials do the people who work for the local county systems have? So in Indiana, the patronage system is a very important way that we make decisions. And the question we have is, what kinds of quality in terms of staff member quality, in terms of the people who work for the county systems, what kinds of skills do these people have? So as we look at this issue, we have all kinds of politics involved. And really, if I can ask both of you this question, why should politics, or in a sense of partisan politics, be so involved in health issues?
I think that's part of the nature of the game in Indiana, as you said, and as we were talking earlier, that boils down to local autonomy and wanting to maintain the advantage that a local health department has in making their own decisions on personnel matters and on program matters. There are standards at a state level as to the local health officer and who he has to be. You know, it's required that he's a medical doctor. We do very extensive reviews on any prospective local health officer before he receives an appointment. His appointment has to be authorized by the executive board of the Indiana State Board of Health, which is sort of our board of governors. It's again, it's a somewhat partisan board that has been appointed by the governor. But they are mostly public health professionals. There are physicians and nurses on our board, and their primary concern is to put somebody in charge of the local health department that is aware of public health issues and is qualified and competent to do the job and is willing to do the job. Again, because of the disparity from county to county, we have some areas where, with very small populations, where we only have a part-time local health officer. He doesn't serve full-time. He's a private physician living in the county who works on maybe at 15 or 20 hours a week with the local health department to deal with public health problems, and then the rest of the time he's in private practice.
May I interject that that's more typical?
Exactly.
Than not, right?
Now, and there has been, the only restriction at this point is that each county has to have their own local health officer, their own local health department.
How much scrutiny goes into that?
A fair amount. For example, we had a problem in one of the counties in the southern part of the state last year, where the local health officer had been accused of some improprieties in terms of putting some of his personal patients into an unlicensed nursing home facility in that county.
So what you're saying is the situation in Delaware County isn't all that unique.
Well, No, I wouldn't say that. The situation in Delaware County is definitely unique in terms of the extent of the problems that we are looking at. But,
excuse me, but if we get back to the patronage system, whether you're patronage Republican or patronage Democrat, it seems to me that political party has nothing to do with good health. And why should somebody's crony, if it comes down to that, be appointed to any board in this state? And it seems to me, if we look at the issue of accountability, why should we look at cronyism, which is oftentimes what this situation could come to?
Well, I think the law has probably tried as much as it can to take this out of politics. It says, like, if you have a Democratic mayor and a Democratic board of commissioners, you can't have 7 Democrats on the board of health. At least 3 of them have to be Republicans. And I think that's as far as the state wants to go in terms of depoliticizing the matter.
And again, it would be very, very difficult to write specific guidelines that would apply equally to the large counties, the medium-sized counties, and the small counties in terms of what the qualifications for staff members are, what their experience would have to be, political patronage, who they would report to, things along those lines. It would be tremendously difficult. I think that's why the legislature feels very strongly that these sorts of issues have to be dealt with on the local level, because they don't have the time, and we certainly don't have the time in the staff to take day-to-day control or insight into the operations of the 96 different local health departments in the state. The best that we can do is talk to them on a regular basis and give them a plan that they can work from, and then try and make sure and do follow-up evaluations to make sure that they are indeed following that plan.
Before the State Welfare Department took over more of the administrative control of local departments, there were local boards in each of the 92 counties that carried out a lot of the administrative duties. Still, the employees of the welfare department were state merit employees who had to go through the state personnel department. Why wouldn't that work for the health department, where there were certain standards, perhaps levels of education or levels of experience, that local health department employees had to meet, given the fact that they are responsible for carrying out a tremendous load of state health regulations?
That's probably not a bad idea. That the situation that we're seeing in Delaware County may be something that might be the impetus towards leading towards that kind of change in the system. That's not something that the State Board of Health has the authority to enact or to decide upon. That's clearly something that our legislature would have to make the decision on. And I think this is the kind of example that would need to be shown to our legislators as saying the system doesn't always work the way you have set it up. Maybe we do need to make some changes in that.
Sometimes local control doesn't deal with it.
Since we're using Delaware County as a case study, Lorraine, as a member of a task force, let me ask a couple of questions. First of all, what does a task force do, or the members thereof? And number 2, what criteria do you think should be for members to serve on a county health board?
The task force came about because there was a real problem in Delaware County. And unfortunately, from my base data, this is not unique to Indiana. It's not unique at all. Very often, the health officer is a part-time position, can get away with a lot of things because it's only a part-time position. The task force came about because there were real concerns in our county. The health services were not being delivered. The budget was there, everything should have been in place, but they weren't being delivered. We had real concerns as to what was going on. The League of Women Voters in the early 70s came up with these problems, and they said there should be a public health nurse. The typical health department would have a public health nurse. We did not have one. We're one of 7 in the state of Indiana that does not have a public health nurse. There was a real need there. We came up with all these kinds of things. We had a real problem with what was going on locally.
This was an independently formed board, though. I mean, I want to make that clear that you weren't sanctioned by any governmental body at all. It was a group of individuals who saw a need and decided to, and as it turned out, to force some action, to force some scrutiny of the health department.
That's right. And I would hope that we would serve as a model for other counties in Indiana and across the nation, that citizens can make a difference, because that's what we were, concerned citizens. And we came up with the plan that you need to have more health services offered. why isn't it happening? And we had to, in my mind at least, pursue so many avenues that ought not to have been pursued as extensively as they were.
So the task force then is a voluntary association of citizens who are concerned about problems in health, and you and your group felt as though that certain things were not being done here in Delaware County, and that you got involved.
Exactly.
So it's a very good example of local democracy in action. In
That's
a sense,
right.
the health board in this whole process is a very good example of democracy in action.
Exactly.
Dave, you can probably address, what extent did various complaints and input from the health task force, what did that have to do with the State Board of Health getting involved in local scrutiny?
Well, that was basically the entire rationale behind our involvement. That plus some complaints that we'd received independently from members of the public, basically about administrative problems and failure to provide services that are required under state health law. And when you get into that kind of a situation, it demands an immediate intervention and investigation. We had some problems. There's kind of a misunderstanding, I'm afraid, in terms of exactly what our role in the Delaware County Health Department is right now, with Dr. Cundiff, who's the director of the Bureau of Local Health Services, coming up here, and Janet McShera, who's one of the attorneys from our Office of Legal Affairs. One of the Indianapolis TV stations reported that we had, quote, taken over the local health department, and that's absolutely not correct. The executive board of the State Board of Health, by law, has the authority to take over any local health department in the state. They met in executive session at their December meeting to hear some of the evidence that we had collected and some of the other investigative agencies had put together, basically to give them a clear understanding of what the situation here was and what sort of problems were being discovered and were being looked at further. And they had the option at that time. They could have directed the State Health Commissioner, Dr. Myers, you are going to intervene and take over the Delaware County Health Department and run it yourself through a proxy, who probably would have been Dr. Cundiff. The board specifically did not do that because they felt that the problems were not that severe, and they felt that it would be much more effective to work cooperatively instead of forcibly with local health officials. So what they directed us to do in lieu of that was to have Dr. Cundiff come here on a regular basis, work with Dr. Ware and the other officials of the local health department, basically just to oversee the operations, to nudge them along in the right direction, sort of, and to see for himself how things work and what things weren't working. Janet McShera is here basically to serve as a legal advisor on what services are required to be provided, what laws are involved, and to answer any questions pertaining to that. So right now we see this basically as a cooperative kind of arrangement where we're consulting and advising as opposed to coming in and actually making the day-to-day administrative decisions.
If I could distinguish between policy politics and system politics, the local board is supposed to make policy. It's not supposed to be in system politics of dealing with local members of the health organization who work for the health organization.
So, yes.
And oftentimes it seems that when there's a problem that the members who work for the local health organization tend to go to the board members, and that policy-making implementation mix seems to get all backwards. So it's my understanding that the board speaks to implementation of certain policies and then somebody else carries it out. The board is not supposed to be in daily
Yes.
implementation of policies. Is that the way it's supposed to be set up?
Yes.
Okay.
It's been, I think, in our county, I hope, a real model for what might happen in other counties. I would have to ask the people listening that are not in Delaware County, do they know where the monies are going?
Absolutely.
Do they know where the monies are going for the birth certificates, death certificates? Health officers very often are part-time positions, and therefore it's very difficult to put them accountable. I have a real concern, because they are part-time positions, that the community has a very difficult time in trying to pin them down as to what you're doing and why you should be doing. So the message that I have is that everyone would look at what their Board of Health is doing. We're talking about a lot of tax dollars here. We're talking about tax dollars that should be used to promote the health of the very poor people, low economic group. We're talking about the taxpayer. My money's going into for what? The Board of Health in Delaware County, Middletown, USA, if you will, it has been down the drain. The investigations, I'm sure, will prove that. We have a real problem. And the message to people listening that are not in our county is what's going on in your county, because the information I have received is it's not all that different in a lot of situations.
Yeah. Something I'd like to add to that real quickly is that the State Board of Health is in the process of doing or has already completed assessments of the current state of local health in all of the local health departments around the state, basically judging them according to the 11 standards that we have, and essentially rating their performance on how well they're doing in each of those areas. Those are all public records. And any individual that would like to see how their local Board of Health is doing, or more importantly, not doing, can contact the State Board of Health. They can come to our offices in Indianapolis. Those are open public records. All they have to do is come to the Division of Local Health Support Services and ask to see the records for Delaware County or anywhere else. And they can have it. They can make a Xerox of it and take it back and show it to other people down there. And it would be a very, very effective way for the people of any individual community to get a handle on what's going on there and then begin their own process of getting more involved in it.
You know, Dave and Lorraine, I think what you're addressing obviously is the issue of incompetence. We're really concerned about competence as far as health is concerned. Well, let me ask this philosophical question. As there's more incompetence coming up in various locations throughout the state, with this issue of privatizing the services, in other words, because of low salaries perhaps also, you have the privatizing of health services out to, for example, I think of Planned Parenthood here locally. So are you not taking this task in a sense, if you don't pay people qualified salaries in terms of getting qualified persons, and if incompetence results, aren't you getting into a philosophical issue where you privatize these services from the public to the private sector?
I feel that the main thing that has occurred is there has been incompetence, no doubt about that. But we are not unique in Delaware County. I would say that Middletown, USA has a real message to the people of the nation, that if it can happen here, it can happen anywhere, and in fact it is. The real message to me is that there has been a lot of overlapping issues. There has been politics in the negative sense that, you know, the old crony thing, the good old boy. We saw this as members of the task force. I was in a meeting of the Board of Health, and I was referred to as the little lady in the back. You know, so there's the sexism, there's discrimination. I was recommended by the task force to possibly be a good person for the Board of Health. I went in, turned in my resume, a commissioner was sitting there at the desk, and what was my affiliation with Planned Parenthood? That's what they wanted to know, not any other qualifications I may have had. There has been, in fact, politics in the most negative sense, discrimination, and more importantly, accountability. The Board of Health has not been, as they should be, accountable to the Indiana State Board of Health. They have not been accountable to the people that appointed them, the commissioners and the mayor. Our mayor, unfortunately, has loyalty to people that did for him. That's where it's at. That's very unfortunate, but that's where it's at. Not for the people that appointed him, the people that think our mayor, we're going to have someone that's for us. I'm very discouraged.
That's the political system, and we all operate the political system. The legislature is part of the political system. And I think what you're looking at, John, is the legislature, which is basically a conservative body. If you're talking about privatization of these services, unless the federal government orders that kind of action, it's unlikely the state legislature that is not willing to provide enough funding that you could hire a full-time local health officer. I mean, you'd have to pay a medical doctor to give up his private practice and be a full-time health officer. I mean, you're talking about quite a bit of money to attract the kind of people you want. And the legislature has not shown the willingness in a lot of areas, obviously, to throw a lot of money into it. You know, we're low on per pupil spending in education, for example. We're a conservative state, and the likelihood that Indiana is going to be a leader in terms of large health budgets or large education budgets is highly unlikely.
That's true. We had a tremendous breakthrough just in the last session of the General Assembly. For 20 years, we had been trying to get the state legislature to get out of the mindset where they would be willing to give money to local health departments, but only if there were strings attached, only if it were for specific programs that they had already approved. Basically, you know, the concern was if we give them money for this, they're going to be spending it for abortion clinics or, other sorts of controversial kinds of issues. Representative John Day from Indianapolis in the last session introduced an amendment that was passed that added a provision to the cigarette tax that now takes a half a cent from the cigarette tax in the state and puts it into what's called the Local Health Maintenance Fund. And every local health department in the state is now eligible, based on their population, to apply to the State Board of Health for a specific amount of money per year that is available to them in essentially an unlimited, unrestricted basis. There are areas, obviously, that it has to apply to public health areas, and they have to spell that out in their application to it. But from our standpoint, we don't care whether they want to use it to hire a public health nurse or to hire more sanitarians to go inspect restaurants or to do more health education or to improve their environmental health or to do a better job with vital records or communicable disease control or any of the categories that we're responsible for. As long as that money is going to be applied in those areas, that, as far as we're concerned, that's great, and we do a review of their application, and that check goes in the mail, and they get that money. Yeah. And that was a tremendous step forward in terms of state support for local health services, but I think we probably need to do a lot more.
That's a good place to stop, and we have to stop now. We're out of time. Thanks to our panelists, Lorraine Jones, Dave McCarty from the State Board of Health, and John Rouse. I'm Larry Lough. Thank you for joining us.
If you have comments regarding this program, please address them to John Rouse, Box 149, Muncie, Indiana, 47305. The producer for Public Affairs Roundtable is John Rouse. Associate producers are Mike Seaborg, Bill Mosier, Nancy Carlson, and Steve Johnson. This program is a production of University Media Services and the Department of Political Science. Facilities and funding are provided by University Media Services on the campus of Ball State University in Muncie, Indiana.